Cases of COVID-19 are rising exponentially in Alabama's largest metro area because a new, highly contagious variant is spreading among the unvaccinated, and public places should consider a return to requiring face masks, the head of the area health department said Thursday. Dr. Mark Wilson, the health officer for Jefferson County, said studies have shown that the Delta variant that's taken hold in Alabama can spread between people in less than a minute, so any indoor area where people gather might need a face mask requirement or at least a strong recommendation that people wear them. The 7-day rolling average for new cases of COVID-19 has risen eightfold from 13 to 107 a day, he said, and additional new cases and more deaths linked to the pandemic are inevitable, he said. The tragic thing is that almost all of these deaths will have been prevented if only those people had been vaccinated, Wilson said. The problem isn't isolated to Jefferson County. Only 8 of Alabama's 67 counties aren't considered at high risk for the illness caused by the coronavirus, and roughly 50 more patients a day are being admitted to state hospitals with COVID-19, which already has killed more than 11,460 people in Alabama. With only 31% of the population fully vaccinated and nearly all the new, most serious cases among people who aren't inoculated, Wilson said the state's vaccination rate is way below what is needed to control the pandemic. Cases have surged since the July 4th holiday, which officials feared would lead to new outbreaks, Dr. Scott Harris, the head of the Alabama Department of Public Health, said in a video update released by the Medical Association of the State of Alabama. Right now we are seeing some pretty difficult times here in Alabama, Harris said. Some of the infections are occurring after the type of large gatherings that generally didn't occur until the state lifted health restrictions. Dr. David Thrasher, who practices in Montgomery, said a doctor friend told him about a church in the Birmingham suburb of Trussville that recently held a large celebration for its 200th anniversary, which was followed by a massive disease outbreak. 70 people in that congregation have tested positive, he said. Thrasher said a friend of his died recently and 2 people who attended the funeral became infected even though they were vaccinated. Over the past 2 weeks, the rolling average number of daily new cases has increased by 772, a spike of 280%, according to researchers from Johns Hopkins University. There were about 226 new cases per 100,000 people in Alabama over the past 2 weeks, which ranks 9th in the country.